Assalamu alaikum. This is Ultrascan Diagnostic. This is the CBCT of the patient that you had requested. The area of interest is the upper left edentulous region in the first molar area. This is the panoramic view where we can see grafted bone. This is the transaxial view, which is basically the proximal view. On the proximal view, you can see this is where the bone grafting has been done. From the previous X-ray, we can actually measure that this was the area where we had the crest of the ridge, and all the bone that we see from here, 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 this is all grafted bone. And this grafted bone, as you can very clearly see, is holding up really well. There's no sinusitis, that means there's no perforation of the sinus membrane, and this grafted bone is in relation to the crest, so hence an implant placement should definitely be possible and without any problems. Now we've actually gone ahead and we've done some measurements for the doctor. So this is where our measurements are. So so this is the ridge. We've got a 6 millimeter ridge and we've got 9 millimeters of height. So a implant placement here should be easy and non-problematic. We have also gone ahead and placed an implant for our doctor so that they have an understanding of what the implant parameters will look like. So we have placed a virtual implant. This is a 4.27 millimeter implant. A 4.27 millimeter implant will have some of its threads along the wall of the sinus, but if grafting, if osteodensification burrs are used, so this implant will very comfortably be snuggled in this grafted region. You can even use a slightly shorter implant, a 6x6 implant, which will be completely covered by bone, but the ridge width is not going to support that. So for that, we will advise a 4.27 implant from dentist company in this region. So if you have any further questions regarding this case, please feel free to reach to our team. We would be extremely happy to help. This is the axial view. And on the axial view, you can see that the implant will be completely supported by bone on all sides. And even the apex, there is going to be very minimal area where the bone will be very close to the sinus. The implant will be close to the sinus, but that is something that can be managed clinically. Thank you very much.